And then you talk about the different bony landmarks where you're trying to find the different spinous processes, right? We have C7, T1. C7 is usually the most prominent one as you're coming down like this. Then you have T3 is usually at the root of the spine of the scapula. And then T7 is usually 7 to 9 at the bottom here. Again, that depends is if the person's like this with their arms are down, obviously is that going to change when they do this? Yeah. And then you want to look at the medial border of the scapula. Is it rotated this way, rotated that way? How far is it from the spine? You know, again, if their shoulders are pulled forward, you can have a big separation here. And also you want to compare one side to the other. So here, there's a little bit of an increase of kyphosis. Okay? Now, do you think this is from osteoporosis? No. We'll talk about this as far as, we did mention that in conditions, but we'll be talking about here. There's something called Sherman's disease. It's common in adolescent males. And what happens is you have, on the end plates of the vertebra, you have kind of these like invagination types of things where the end plates are irregular. And then what it does is it causes so this is posterior where the spinous process is here. So the anterior part is smaller than the posterior part, so they tend to have kyphosis. But it's going to tend to be more isolated at a particular area versus throughout the whole spine. And it tends to usually be either at the mid-thoracic or down lower. When I've had patients with that, it's usually about right here. Whereas in osteoporosis, it tends to be kind of pretty much right in the middle. And then here, this is talking about a specific thing here. So then on page 46, we're talking about round back. And then that's another situation where it's almost a postural type of a situation where some of the muscles are contracted. The trunk is going to be flexed forward with a decreased lumbar curve. And then they tend to have tight hip flexors, tight hip extensors and trunk flexors with weak flexors. So it's kind of like that cross-postural syndrome. Yeah.
How do they treat that Sherman's disease? I mean, can they, or is it?
Mostly I just adjust them and keep their spine moving.
But for the most part, they have to live with that kind of.
Yeah. Well, I mean, a lot of times it doesn't do a real pronounced. There's different severities of the cases. A lot of times you're not going to get a real pronounced kyphosis. You know, basically, here's basically what happens. So you're getting a wedging of the vertebra here. So Sherman's is a developmental disorder, meaning that it happens in adolescence. The end plate starts to become irregular. You get some of the kyphosis. As far as treatment, what's that? Is it progressive?
Like, will it kind of stop?
Usually it stops. Like I've treated patients more like in their adult years where they've had it. It's not progressing, but because of that it's there, they tend to have recurring chronic thoracic pain. So it develops while the bones are growing. Once growing stops, it's pretty much frozen in time the way that it is. It's not something that's typically going to be reversed, but it's more of something, a type of condition where you just have to deal with it and manage it. You know, you need to do, probably what's good is to do like some of those gym ball exercises where you're rolling back on the spine like that, different exercises. All right, now we'll talk about congenital deformities. Where again, this is something that when the bones are being formed, there's abnormal development. Okay, so here, it's an incomplete formation of the vertebra. And then in this case here, there's fusion. So different abnormalities can occur. And if there's a deformity like that and it has a real abrupt kyphosis, then that's called specifically a gibbous. And so if the kyphosis occurs over a longer stretch of the spine, it's more gradual, whereas this is a gibbous. And for something to be abrupt like that, it's either going to be some congenital malformation or some traumatic fracture that compressed one particular vertebra, or some type of tumor, bone disease. It's not going to occur with your typical like osteoporosis, gradual kyphosis. It's going to be something that affects the bone. And so now there's another type of situation we talk about with the flat back, and basically that's where the normal lordosis in the low back is reversed or flattened. And then also you can have a loss of kyphosis in the upper back. The spine tends to become straight. A lot of times it's because of compensation from some surgical type of thing here. If somebody's stuck forward like that, then the thoracic spine is going to come up like that, and you're going to lose the kyphosis. And it can happen from some type of DJD or some fusion or spinal surgery. This is the typical osteoporosis type of thing where you're having a gradual kyphosis, and again, it tends to be right about in the middle of the thoracic spine. The vertebral bodies will degenerate. The anterior part of the thoracic spine is more weaker than the posterior part, so it tends to compress anteriorly. And it's typically postmenopausal osteoporosis. Then we'll talk about scoliosis. There's two main categories of scoliosis. Anybody know what those are? I'll give you a hint. It's in your notes. Functional and structural. Gee, how'd you come up with that? So, obviously we talked about some of these deformities. If there's a change in the bone, what do you think that's going to be? Structural or functional? Structural, right. So, if you can have different wedging or malformation of the vertebra, and then that's going to cause, so let's say if something wedged down here causes my spine to go like that, what's going to happen to the upper part of the spine? It's going to curve back because you have a lot of equilibrium and vestibular types of things that try to keep your head upright or your head level. So your body's going to compensate. If one thing starts to curve this way, it's going to go that way. Just try to compensate for it. And then you can have functional types of things where maybe there's something going on with the pelvis that causes it to bend obliquely like that, and then this is going to compensate. Right? So the difference is between functional and structural. And then obviously if you're going to have scoliosis, it can cause other complications. Maybe it might affect the nerve roots, sciatica and things like that. What the issue is with scoliosis, and again, most commonly it's what's called idiopathic. What does that mean? Who knows what caused it, right? It's a lot of times seen in kids in their growing years, early adolescence. That's why they do the scoliosis screenings in schools and things like that. It typically doesn't continue to progress as you get into the older years. It's like a lot of these types of things. While the bones are growing, things are changing. Once the bone growth stops, then they tend to stop.